Myself. My name is Nicole Jones, and I am the Director of Risk Prevention. And I'm going to let my associate introduce herself.
Hi, everyone. My name is Jill Shumate, and I'm our Division Director of State Support Coordination.
And today we're simply going to go over transition procedures. The DMH has been working on developing an online policy and procedure manual, and transition procedures is one of those that we've been working on the past several months. So we're going to discuss those procedures today, and most of it is very much the same. So it'll be a kind of a review with minor updates and roles, and we're going to get into those as we go through. So let's start. I wanted to start with what is a transition first. And really a transition is the process of an individual either physically moving to a new home with residential services or changing residential providers. A transition is made up of 5 different phases. First being provider selection, then planning the transition, coordinating the move, doing a post-move follow-up, and then transferring of the individual's record if applicable. So those are the 5 different phases. And who does this procedure apply to? So it applies to all individuals who have a comprehensive waiver slot who are moving into a new home with residential services or changing residential service providers. And it also includes youth who have a comprehensive waiver slot funded through an IDA with Children's Division.
So what's really changing with these procedures is, honestly, we won't have the previous RPC, the Risk Prevention Coordinator, or formerly known as Community Living Coordinator, will not be on those transition calls. So that responsibility is being shifted to if that support coordinator needs additional support to host the transition calls, they will get support from their supervisor, SC3, or another role that might be within your agency that can mentor and support a support coordinator. And then if additional support's needed, you can pull in the assistant director or regional office director from your region. So most of this should be a review for you of the transition policy and procedure. So what we've done, I know Nicole earlier went over all of the different areas of a transition, and so we have divided a procedure for each of those 5 phases. So I'm going to get started. We're going to start with procedure 9.4B, provider selection. And I also want to let you know before I get started, these were posted today, and you should be getting an email blast from DD Mail today. So be looking for that, but they are posted currently on our internet site under the governance tab. And I can put that in chat a little later. So if you want to go look at these policy procedure documents, Nicole put it in chat. You can go there and look at them and kind of follow along with us. So I'm going to cover the responsibilities of the of provider selection. So really, this part has not changed. The sending support coordinator is already responsible for meeting with the planning team, identifying the need for either new residential services or the individual wants to move from their current residential service provider to a new provider, find a new roommate, all of those things that they're currently doing. So they'll initiate that transition process, help the individual through selecting a provider, which Nicole's going to go over all the procedure steps to this. So they'll facilitate those meetings, help meet with the identified providers to find a good match, and then they also do the HCBS, the home and community-based services kind of compliance thing, making sure that the new home will be accessible to the person based on their identified needs, integrated and supports full access to the community, and that it meets all requirements regarding an individual's rights of privacy, dignity, respect, and freedom from coercion and restraint. This is really the change. So the responsibility of overseeing the calls will come to the support coordinator supervisor or the support coordinator designee, so someone else at the agency that can support that. So they'll provide additional technical support to those support coordinators for any transition deemed emergency, or probably any transitions that just need additional support. So technical support includes, but is not limited to, facilitation of those emergency transition calls, doing some additional provider outreach, helping with plan amendments, submission of emergency utilization review requests, and then increased coordination with the individual's planning team. So really just there supporting that support coordinator throughout the process.
And for the risk prevention consultant, responsibility is going to be shifted to only transitions deemed an emergency, and the support will look like providing consultation on provider capacity to support the individual's needs, being able to provide tier 2 resources to individuals that are currently in the hospital, jail, or some other temporary provider, or that might need additional support supporting the person. Serving as a liaison between tier 1, tier 3 behavioral health and any other state and local resources as appropriate. And RPCs are responsible for connecting teams with these resources. They're not responsible for developing or implementing individualized supports. They will also be overseeing the transition inbox and the consumer referral databases. And much of those duties will be with our administrative assistant for our team. So let's clarify what are emergency transitions. An emergency transition is when an individual is currently in a hospital, jail, a temporary treatment center like a crisis bed, who's ready to discharge from either state operated or they're already considered homeless. Regional office directors and assistant directors may also request that an individual outside of those established criteria be treated as an emergency or a red hot case on an as needed basis after reviewing the needs of the individual. And then they would send that notice to us at the transition inbox if they're in one of those elevated statuses. So let's get into the procedure itself. To initiate a referral, this is all the same as it is currently today. The sending SC will complete a consumer referral packet, which includes the referral profile form, the housemate compatibility tool or survey, their current ISP or BSP, any amendments. If the individual's under the age of 21, they need an authorization for disclosure, so we can do juvenile sex offender checks. And then they would also need to indicate in the email whether this case represents an emergency transition. Then once that referral has been sent to the inbox, we will be responsible for managing that inbox. Our administrative assistant will be reviewing the referrals that are sent in. If a referral is considered incomplete, they will notify the SC that the packet is incomplete and why, and ask that they submit a new one. And then the sending SC will be responsible for submitting a complete packet. If after the review they found that the packet is complete, the admin assistant will complete checks on the Missouri Highway Patrol Sex Offender Registry and the Juvenile Sex Offender Registry if applicable to meet notification and data tracking requirements. They will also determine whether if the transition meets emergency transition requirements, and if so, notify an RPC lead. Will then assign an RPC, and then they will publish the referral to the database. Once we've published the referral to the database, we will send an email out to the SC to let them know that it is published, provide them the referral number, and let them know whether the case was determined to be an emergency transition or not. Then the sending SC will be responsible for letting the individual and guardian know that the referral has been published and relaying that information. If we have any provider acceptances from interested providers, the administrative assistant will email the SC connecting them with that provider. The sending SC will then be responsible for forwarding those acceptances to the individual and the guardian. If the individual is interested in one of the potential providers, the sending SC will facilitate an introductory meeting between the individual, the guardian, housemates, potential new service provider. These can be in person, virtually, all very much what's already occurring now. And if the individual decides to decline that service provider, we'll go back to the provider selection process, and the sending SC will let the provider know the individual's decision. And then if the individual selects a new residential provider, we will move on to the next procedure, which is planning the transition.
Okay, so we will go over transition planning and the responsibilities. And Nicole, if you just want to hit the next slide for me. These responsibilities, as we've said, really haven't changed. This is currently what the sending support coordinator is already doing. So they're responsible for leading the transition planning process for the individual. So they're setting up that initial planning or the initial transition meeting. They're sending communication to the planning team with the ISP, facilitating those site visits, meeting the roommate, and completing all the transition duties outlined in the checklist for residential community living moves. The sending support coordinator supervisor, or that designee, as we've already stated, will still be responsible for providing additional technical support to the SC for any transition deemed an emergency. So again, they'll be stepping in to provide technical support, to facilitate the calls, do provider outreach, and just coordination with the individual's planning team to make sure necessary supports are getting put in place. Nicole, you can go over the next slide.
So the Sydney Regional Office will be responsible for improving all plans and budgets and supporting the individual's move to a new home. Sending and receiving client information centers, so CIC, are responsible for supporting the transition by transferring the individual's file, ensuring proper communication occurs between regional office team members, and management of the individual's episode of care in Seymour. And again, the RBC will be responsible for supporting teams for those transitions that are deemed an emergency. And again, that's consulting on that provider capacity, offering supports to those temporary providers like hospital, jails, crisis beds, coaching the newly selected residential provider to implement appropriate supports. And appropriate supports look like safety crisis plans, behavior support plans, establishing behavioral medical or psychiatric providers as appropriate, and staff training on recommended interventions in order to increase provider capacity. I'm also serving as liaison, connecting them to Tier 1, Tier 3 resources, behavioral health resources, and any other state or local resources as appropriate. And again, they're not going to be implementing individualized supports, but they will be connecting teams with those resources. So let's talk about the procedure itself. Again, a lot of this is very much the same. A review of the current process. So once a provider is identified, the sending SC will notify the email transition transfer contact designees. So that includes sending and receiving regional office contacts, the transition transfer contact at the receiving TCM or RO, and the transition inbox. And you can find all of these at the transfer contact brochure, which is on our website. And we should include an electronic copy of the ISP, BSP, and a demographic page when making those notifications. The receiving CIC will then notify the regional office nurse of the incoming residential move. If the individual is moving into a host home ISL service site or group home, the sending CIC will also notify the business office lead of the outgoing residential move to end the SMT, which is the Standard Means Testing Financial Questionnaire. The receiving CIC will also open a second episode of care to support the individual's transition. And if, again, this individual has been deemed in need of an emergency transition, the RPC will be responsible providing additional supports to the planning team And again, that goes back to that provider capacity, connecting to appropriate resources, and working with the potential provider to get them ready to support the individual. If the individual is moving into residential services for the very first time, an initial health risk screen and any identified health risk support plan shall be completed as part of the ISB amendment process. The designated residential RN HRST rater will facilitate the completion of the screen and any other applicable health risk support plans. And these will be updated at least annually as a component of the ISP review. It also requires that the HRST be updated through the ISP or when there's changes in status on those HRST rating item scores. And if the individual is going to be moving to a new provider directly from the hospital, the sending SC will contact the hospital as soon as possible to request they participate in discharge planning and ensure that the receiving provider gets all the written medication orders, training and instructions, and any care procedures, techniques, or monitoring and equipment that might be needed. And then we come to the initial transition meeting. So this is the same. The sending SC will schedule that initial transition meeting. It can be in person, virtually, or over the phone. We should strive to have that meeting at least 2 weeks before the proposed move date, just to give time for planning and making sure everything's ready for the move. We will also make sure that the individual is present, the guardian, the receiving support coordinator supervisor, the current provider, if it's applicable, and the new provider at that team meeting. And then you would include sending and receiving nurses if there's needs assessment, like the HRST indicate a need for like a health risk support plan. They should also be included. And if the individual has been determined in need of an emergency transition, the sending SC supervisor or supervisor designee would offer additional technical assistance to the SC during the transition planning phase. During the call, the SC will do what they've done always, is use the checklist and complete sections A, B, and C of the checklist to identify and resolve any pending action items. They'll also then set up a post-move date to occur within 15 to 30 days after the move-in date. And then they will send out the checklist to the planning team after 10 days of the transition meeting. We will also have the sending SC arrange for the individual to be able to do a site visit. And if that can't happen, being able to use pictures or videos or other ways to introduce the individual to their new home. The sending SC will also document the plan for the move and the ISP amendment. And if the ISP becomes due within 90 days of the move date, the sending SC is responsible for renewing the ISP. The sending SC will have the individual or guardian sign all necessary documents, and they will also submit the ISP amendment and budget through the sending regional office's utilization review process.
Okay, we're going to move on to procedure 9.4D, move coordination. And just go to next slide, please, Nicole. So I'm going to talk about the transition responsibilities for during the move. Primarily, this is the support coordinator who's responsible for ensuring that the individual is supported during the move phase. Most of the move requirements are discussed during that initial transition planning meeting, such as what's needed to put in place for that individual to be successful at a new provider. And the support coordinator is responsible for double checking all of those supports are in place and ready and that the move can occur on time. So I'm going to let Nicole walk through the actual transition policy or procedure steps.
All right, so let's move into the procedure itself. So the sending SC and regional office will maintain responsibility for the individual and support coordination throughout the duration of the transition. For the first 30 days after the move, the receiving provider will bill the sending regional office for approved services until the effective date of transfer. For the first 30 days after the move, event reports will be sent from the provider to the receiving regional office and support coordinator. They will be entered into CMOR. The receiving regional office will send a copy of the event reporting form to the sending SC. The sending SC will also ensure that the following items are given to the receiving provider at least 1 week before the move-in date, and that includes the current ISP with any addendums or budget funding authorizations, a safety crisis plan if applicable, a behavior support plan if applicable, current physician orders, current specialized medical information, and information regarding diet and allergies. Sending SE will also ensure that no later than the day of the move, the following is received by the receiving provider, and that includes a 7-day supply of current medications, current physical, vision, and dental exams, the Medicaid, Medicare, and Social Security cards, current immunization records, adaptive equipment, clothing, personal care items, personal property inventory, and documentation of guardianship and payee. Personal spending money that has been assigned to the individual will move with the individual, and personal spending money that is in the provider's account will be returned to the regional office or as otherwise directed by the regional office in 30 days. And then the sending SE will update Seymour with their new demographic information. The sending SE was responsible to remind the sending and receiving providers to review and sign off on that personal inventory form. And if the home is a new ISL service site and repair changes were necessary based on the initial ISL environment site review form, the sending SE is responsible for ensuring that the new ISL home passed inspection prior to the move. If repairs or changes were needed and have yet to occur, a new move date must be chosen post repairs and modification.
Okay, section 9.4E, the post-move follow-up. Transition responsibilities for this is also primarily the sending SC if you want to move forward in the slide. They're responsible as now for facilitating and scheduling the post-move meeting, ensuring that all final components of the transition are completed before it's transferred to that receiving support coordinator. So it's kind of that final wrap-up meeting, responsible for completing any additional amendments, updates to make sure supports are in place before moving it to the receiving support coordinator. So Nicole will go through those steps.
All right, so let's move into the procedure for the post-move. So the sending SC is going to facilitate a post-move meeting within 15 to 30 days after the move. That meeting date is typically set during that initial transition meeting, which is outlined in 9C. The post-move meeting will include the sending SC, the individual, the guardian, the receiving SC, and the new provider. The sending SC will verify on the call that all pieces of the transition have been completed by reviewing sections A through C. So if there's any outstanding items, they're going to make sure that they were taken care of. And then they will review section D of the checklist. If any changes are needed or there's new outcomes and action steps that are developed during the post-move meeting, the sending SC will provide an up-to-date ISP amendment to the receiving SC upon transfer. And then a transfer date would be determined at the post-move meeting, and this should be completed within 30 days of the move. If additional services are requested or needed, the transfer must still occur, and the new receiving SC will complete the request for new services through UR. And the sending SC will then complete the checklist and send it out to the planning team. And the administrative assistant for our team, the risk prevention team, will review that checklist for completion, document that it was completed, and then remove the person from the consumer referral database. The sending SC will then start the administrative file transfer process, if applicable, by following procedure 9F, which we'll get into next.
Okay, procedure 9.4F is the transfer. So go ahead to the responsibilities. The sending SC, just as now, is responsible for completing that transfer form, triggering the administrative file transfer process. And then the sending and receiving CIC, which is also sometimes referred to as medical records staff at the regional office, they're responsible for tracking all file transfer requests. They start and end the episodes of care, and then they finalize the file transfer process.
So let's talk about the procedure for transfer. So once a transfer acceptance date has been determined in the post-move meeting, the sending SC will complete the transfer form, verify that all items on the file audit checklists are contained within the file. The sending SC will then send that transfer packet, which is the transfer form, consumer profile, housemate survey, current ISP, and any addendums to the sending and receiving contacts as outlined in the transition and transfer contacts brochure, which is on our website. And the sending CIC will notify the sending business office of the file transfer. Within 3 days of receiving that transfer packet, the receiving support coordinator supervisor will confirm receipt of that transfer packet, provide an effective date of transfer, and then named the assigned support coordinator. The sending SC will update all the information in Seymour and in authorizations 1 day prior to the date of transfer. The sending CIC will end the episode of care 1 day prior to the date of transfer. The receiving CIC will open the episode of care on the date of transfer, and the receiving SC will enter in all authorizations. The file shall be transferred by the sending regional office or sending TCM entity within 5 business days of the effective transfer date, and the transfer document should include all the documents that are outlined in Directive 1.060, Appendix A. All right, and if you have any questions, where you can also, if you sit and think about it, can send it to the Tier 2 email address, and we'll follow up again with a Q&A document. So you can feel free to send us questions there as well. The last thing we want to talk about is the transition policy timeline. So we have the webinars this month, this being the first. April 17th is another webinar opportunity that we have from 11 to 12 p.m. April 20th, we have our final opportunity for this webinar. It'll be from 3 to 4 p.m. You can also join the Tier 2 Coffee and Chat on May 9th as an opportunity to meet with the risk prevention team and talk more about any questions you may have. We intend to go live with this procedure May 15th, and we will be providing ongoing new hire training probably about twice a year on the transition process for supervisors or SC3s or supervisor designees to be able to make sure that they feel competent in that transition process. So that'll be an ongoing support. And that's all we have. So I think we have time for questions. Going to scroll up to the top of chat. So Erica asked, am I understanding correctly that RPC roles will really be moved to focus on support for providers, taking clients in emergency situations? And yes, that's the real shift, is that RPCs will be focusing on those temporary providers like hospitals and jails, crisis beds that are taking care of our individuals while we're looking for a more permanent provider. So they'll be supporting those individuals and offering supports and resources, as well as any new potential providers that the individual would be interested in moving to. We'd be helping set them up and make sure that they have supports in place to successfully support the individual. Another question from Erica. Is there a timeline from the RPCs to have the client added to the CRD? Just clarification, what we typically do is if you send it to the inbox, we try to prioritize certain referrals. So referrals that are emergency status, so the homeless, they're in jail, they're in the hospital, those come in and get assigned first based on the need and the order in which they came in. From there, all other transition referrals that come in are done in the order that we receive them. During summertime or the warmer months, we typically have a huge influx of referrals. So we give ourselves about 14 days to get to that referral, but typically once we've reviewed the referral and we found it to be complete, it goes on the same day. So I hope that answers your question, Erica. If not, please go ahead and put something in the chat. We're typically below that 14 days, but like I said, in the warmer months, it's just a huge influx of referrals. And so we try to get through it as fast as we can. And we prioritize those with higher needs first. So Catherine Stager Wilson, you asked, is there an example situation of when a regional director or assistant director might recommend crisis placement when the situation doesn't quite meet the criteria? So this does happen. A lot of times, like if we have legislators involved, those can be red hot situations. And we've had some weird ones where individuals maybe were being funded through general revenue and that contract's coming up. And so impending homelessness is happening. And so that's another situation in which a red hot happens, but those are few and far between, not definitely the main way a person comes in through emergency transition. Laura. So TCMs have been informed that once connections implement the systems, it doesn't allow for 2 TCM organizations to be assigned to an individual, which doesn't allow receiving SC to bill. I think that's a great question. So this policy and procedure right now only covers current state. So it has nothing embedded with it about connections. My understanding is that reimbursement can be submitted, but I imagine that'll be something that'll be further teased out as we get closer to connections being implemented. Howard County. When case noting transition hours are both sending and receiving TCMs, logging billable time, do they both get paid? Under the current system, if you have 2 EOCs open, both of them can get reimbursement for the transition process. Coley Haycraft, the checklist for residential moves was updated in March, but this update was not shared to all regional offices or TCMs. When is it mandatory for this new form to be utilized? So thank you. I believe we did share this update in our Tier 2 updates webinar on March 31st. And right now we're not making it mandatory because we realize there's always going to be a little shift in the change. So we don't have a mandatory date. Both are acceptable, but we would recommend people using the new form and shifting in that way. And so using the website as your main place to get all updated forms, I think is a good practice to continue to do if you are already utilizing that. Erica, did you say there's a requirement for SCS to be on all transition calls? No, there is not a requirement for supervisors to be on all transition calls. They would help in those emergency transitions and any other transitions where a supervisor or a support coordinator might need additional support, technical support from the supervisor. And Erica, you also asked, support coordinators will receive training. Yes, they will. And we will have ongoing training as a support. The transition or the risk prevention team last year offered monthly transition workshops for supervisors to attend to get training on the transition process. We'll continue to do that going forward. It won't be on a monthly basis. It'll probably likely be twice a year. Tammy, I hope we answered your question, but a CIC is a client information center. There are records people in the regional office. I will have to get, so Nicole, you asked a question about the HRSA needing to be completed and whether that is responsibility of the TCM agency or the new ISL provider. I'll have to get back to you on that. And so we'll follow that up with a Q&A. Unless, Jill, do you have any?
My understanding is that it will be the ISL provider, but I think we need to get clarity and make sure that's communicated to the providers as well. So we'll have further conversation and then update the answer on the Q&A.
Kim asked who does the environmental review. The sending SC is responsible for the environmental review, but typically, like you said, Kim, the receiving SC will do that as a courtesy. As of right now, that's the process. Once Connections goes live, we'll probably have to look at that and see what we'll be able to do with that new process. So. And Molly, same with your question regarding being able to complete transfer tasks together, since you both can't bill in Connections. But as of right now, this policy covers current state and doesn't include any of the connection updates that'll be going live later this year. And regarding Lynn, so in some instances, a courtesy, she says an EOC needs to be open both at the sending and receiving ROs. And then on the transfer slide, it said that it opens when the other ends. And yes, you're correct. During that transition process, a lot of times it's the practice to open an EOC as a courtesy, so the receiving team can bill. Doesn't always happen, but at a minimum, once it comes to transfer, the sending regional office will close their EOC the day before transfer. And if it's not already open, the receiving regional office will open their EOC on the day of transfer. Erica, we will try to get that Q&A out as quickly as we can. I don't have a timeline, but we will work to make sure that that happens for the Q&A. So Coley asked, what's the reason for including the individual signature on the checklist for community moves? That's because this is the individual's move, and we want to make sure that they have a voice and a chance to make sure that they are a part of the process. And so we really wanted to make sure that they're included, including, the checklist that kind of outlines everything that has to happen within a move. So that's the reason we wanted to make sure that that form was person-centered and the person was being included in that move process. Nicole, regarding training, we will be updating our training on the community transition website. And then the ones that we're going to hold twice a year, we'll probably send out blasts and have people register for those. So Samantha, is the individual, the place that they found, is that with a residential provider? No? Okay. Well, then they wouldn't need to be a part of the transition process. If they're not under a residential provider and receiving residential services, you wouldn't need to complete an ISL environment review form. You'd only do that if they are receiving residential services, ISL services. Max, is there any way SCs can get an access to the consumer referral database? I don't believe we've discussed that in the past. And because the consumer referral database is a dying system, once Connections goes live, we'll no longer have a function. So we're probably not going to ensure SCs can have access to that. It would be a nightmare kind of to try and get everybody on that. So if you ever need information about a referral, you can always reach out to the transition inbox and we can help you get any information.
And Nicole, I see we skipped over Wendy McLaughlin's question about Hearst. So she asked Hearst, what if they move prior to Hearst implementation? So this transition policy and procedure goes live May 15th, and Hearst actually is implementing May 1st. So if someone moves within the next 20 days, you'll still follow the typical health inventory process that we have in place now.
Yes. Thank you, Jill. I didn't see that. And then Eric, I believe we've talked a little bit about that training. We're planning to have a recorded training posted to the website, and we'll have ongoing training, live training moving forward, and that'll be communicated out. And Terry will get back with you again with the HRSA. We think it's the ISL, but we're going to have to follow up with a Q&A on who completes the HRSA. And Laura, I think that's a good conversation. So is value-based purchasing being considered for TCMs who meet transition timeline goals? I think that's a good thing. And I think we are open to exploring and increasing incentives. And so that could definitely be something that is looked at. And Laura, are you talking, is the signature you're talking about for the checklist? Ideally, we would like them to sign off on it, but if not, the guardian should be acceptable. I mean, again, this is their move. We want to make sure it's person-centered, so making it any and all possibility to make that happen would be the best practice. And that's it. I think that's all the questions that I saw come in. Did I miss anything?
That is all that I had seen.
Does anyone else have any other questions regarding this process? Like I said, most of it is very much the same to present day practice. The real shift being the roles between the RPC and the support coordinator, supervisor designee. Yes, Terry. So if anything happens during the post move, and I believe it's in the procedures as well, the sending or the receiving SC would pick up that torch and go from there. So Max, does tier 2 still help with emergencies? So it's a little of both. So tier 2 will be helping for emergency transitions, but their focus will be on those temporary providers. So hospitals, jails, crisis beds, homeless shelters that are supporting our individuals and connecting them to resources, as well as any identified potential providers. They would be meeting with them and trying to make sure that they have supports in place to be successful with the person. But regarding like the technical support and oversight of the transition process, that would be the supervisor that would take on that role. And then Candace. So is there ever a time when a transfer would occur after 30 days? In my experience, not often. Occasionally, it does happen. And the only time it did is when we had issues with the payee situation and finding a new payee. And so that took some time. Melissa. Environmental reviews is the sending SC's responsibility, and typically, as a courtesy, the receiving SC will do those site reviews, but it is technically the sending SC's responsibility to complete that environmental review for ISL services. So Terry, just like it is right now, any safety crisis plans, health information, any of that needs to be in the ISB should be the sending team, making sure that that's all up to date prior to transfer. And then I see the start of a question, but I'm not sure. Okay. Any other questions or concerns? Candace, they should still, they should be working on that and trying to get that done because it is their responsibility prior to transfer. Kim, no, but it will be. I think Kat put in the chat where they will be posted at the very beginning, and I'll let Kat put that back in the chat. Yeah, okay. So Cindy says if a sending SE has not completed those components and there needs to be a staffing change, an amendment would be needed. This is when things get difficult if the sending SE has not completed those changes or have not gone through due process yet. Yeah, I mean, I understand it's a challenge, especially when you have to go through UR or due process and you're related or you have different timelines to expect for those. It still is within the policy to try and sending SE to get that all in and done. And if there's complications with that, we strive to make sure that that is completed as much as possible. And if not, having to work between sending and receiving on a plan to make it happen. Candace, can you explain what you mean by your yeah. So that does happen. And if they do put in a notice that comes through, that should go through RedCap, we'll get a notification and we'll have to put them back on the CRD and go from there. Ideally, with RBCs moving for those emergency transitions, being able to support the providers, we'll see less of that, hopefully. So ideally, you'd follow the transition process, right? If they've not given notice, you should set up transfer and plan to go ahead. I would also suggest that if a provider is struggling, that they reach out to the tiered support team to get some resources, maybe some help to support that individual. Because the earlier we're aware of any issues, the earlier we can come in and provide some additional supports if they're interested in receiving those. Any additional questions? Okay, well, I don't want to hold anyone hostage. So if there's no additional questions, thank you for attending. Again, we'll have additional webinars on the 17th and the 20th, and we'll be following up with a Q&A with this presentation, which will be posted where Kat put in the chat box on the previous webinar page. Appreciate everyone coming and giving us your questions, and have a great day.